This is an awesome video, and it needs credit.
Oh my
Look
God.
at that.
This is
Look at your jawline. It's really nice. You had a cyst under your jaw, which is actually a pretty good place to have it. I was actually shocked when I saw that because I was like, why is it black? You had me fooled here for a second because I was like, what is this? Why is this thing black? Why does it look like charcoal? But I realized that you were smart and you made it black and white so that we wouldn't get grossed out or you wouldn't get blocked or have some kind of things that happen to me all the time, really, on my page. Now, since you couldn't show the beautiful part of a cyst being extracted that people enjoy so much, here's a piece of burrata cheese. Looks very similar when we squeeze out the contents of a cyst. Okay, I had to stop everything and show you this video. This is a dermatologist using a curette on what I thought was
we made an honest
a
attempt
wart
to get it.
at first.
Like
It looks
a
like a
real
wart,
honest
but the
attempt.
light's too bright.
Now,
But you have to see this. This is amazing.
This
If
little
you
guy.
are this dermatologist,
oh my
respond
gosh.
here, or if you know who this is, because this is an awesome video, and it needs credit.
Kidding. Oh my
Look
God.
at
This is a great video.
You have a sponsor like that.
We got that on video.
That's crazy.
Dude.
And amazing.
This
Kudos.
monster
Monster.
was in Jake's phone.
That's
Okay, this guy looks like he's in some kind of restaurant or something. He's got a nice little dress shirt on, and someone's taking a toothpick and poking at this. It's either a seborrheic keratosis or a lentigo, like a benign growth, like a sunspot on their skin. I hope it's not a mole, like something that he's been living with for a while. And he's using a toothpick, and it looks like the area is what we call frosting. So I'm guessing that he's dipping this toothpick in a liquid, which is like a chemical peel acid. Like trichloroacetic acid, TCA, will do this, where when you apply it to the skin, it will frost in a couple of seconds or so. And that frost is an indication that you're getting a certain depth of chemical peel. So I think he's doing this to help that to peel off. But you have to be really careful. If you overdo this, you could peel too much of your skin and cause permanent hypopigmentation, depigmentation, and scarring. So be very... Many of us know when we have blackheads and whiteheads on our nose, even on our chest and our back, but many of us don't know that we have blackheads and whiteheads in our ear. This is my son. He has a blackhead in his ear, and I would look at it every day when we were driving in the car. I couldn't keep my eyes off of it. It drew my attention. He didn't even know it was there. Actually, it's pretty common to get blackheads in the ears, and this is because the composition of the skin on the ears is very similar to the nose, which they both have a lot of oil glands, sebaceous glands, and they both are more prone to blackheads and whiteheads. And this is what happens when your mom is Dr. Pimple Popper. You get a blackhead extraction at home. Okay, I'm thinking put some gloves on. Those are some long nails. Getting those sebaceous filaments or those some blackheads and whiteheads in this strip here, this kind of pore strip. I also would choose a different color for the pore strip. I don't like that green color. It just, it doesn't look clean. It makes it look like there's algae involved. Yeah, and I just don't like to see those nails. This is somewhat satisfying, mostly highly dissatisfying, I would say. I had to stop because it makes my nose itch. What do we have here? This is a little lancet that they have, and they're pulling out these hairs. You've got ingrown hairs in there, which I think is a good thing to do, but I wouldn't pluck them. That's a big deal, actually. When you pluck them, that means that it has an opportunity to happen again because that hair has to grow up from underneath the skin and pull out. I would actually trim that short instead. See how that one is already, that actually had two hairs growing out of it. One of them was probably still good and the other one was stuck in there. So that is... Do you have moles on your face with thick hair growing out of them? Have you ever plucked the hairs, or are you scared to? Do people tell you that this is dangerous, that this can increase your risk for cancer? Well, they do on the internet, but let's break this down. I mean, if you had a mole like this on your face, could you just leave it? Could you just let those hairs kind of hang down and just catch the eye of everybody that you see, that you talk to? We dermatologists know that this kind of mole that you have is a mole that you're born with because it has terminal hairs or regular hairs growing out of it, not like the little vellus hairs or the little fuzzy peach fudge hairs that you can get on your face. These are dark, thick, coarse hairs. So let me tell you, it is okay to pluck these hairs, okay? But just don't overdo it because there are risks just like anything else. Side note, I used to have a mole like this right here, and my dad, who's a dermatologist, he pinned me down one day and said, I'm gonna take that mole off for you. It healed really well, obviously, but it had hairs like this growing out, and I would pluck them. Plucking these hairs is okay. It does not increase your risk for skin cancer. Maybe if you overpluck, you could get an ingrown hair, a little local infection like that, like a pimple coming out of there, and that will be a hassle and scary too, but it is not gonna be life-threatening. Really, if you have this mole removed with just a shave, the hairs can grow back because those live under the skin. But this hair is pretty flat. If you really wanted this to be removed, you'd have to excise it and leave like a linear scar. So it's a bigger deal than it might be worth to you. It might just be easier to pluck or trim those hairs. If I popped into the seat behind this guy, he obviously knows it's there. It doesn't really bother him, but that's a cyst. This patient I saw last week has two different interesting things going on her face. This is a milium, and this is an open comedone, aka blackhead, aka solar comedone in her case. A milium is like a very superficial cyst, so you usually have to make a nick in the surface, and I anesthetize first. I like to use a comedone extractor. I can really see what I'm doing and express it. There's a little sac there. The difference is with a blackhead, or an open comedone, it's sort of exposed, and you can make a little nick. You may not need to, but you can squeeze it out here. I use my fingers, and I think she's got another one on her neck, or on her cheek, sorry. And they're very satisfying to remove. This doesn't really have a sac. It's just contents filling up a pore. Satisfying though, huh?
No, I do not know how deep.
I'm just popping in to say, I don't really get this because are these scars created from a brow tattoo? I'm assuming that the tattoo, well, this is just too deep. What happened here? This is more than just a tattoo. Those are deep scars. So there was deeper penetration into the dermis, the deeper dermis, probably the subcutaneous tissue too. And those are very difficult to remove. I think that they would have to be excised in some way and just trying to leave a smaller linear scar. But the nice thing is it is in the brow area, so you could hide them with tattoos. And I think this is doing a really great job too to make them less noticeable if they bother you. And I think the trick too here is to embrace our sort of the negative things or the things that we can't control, or and sort of make them beautiful. And I think that that's what's happening here as well. And they're covering these. I think that this is not permanent though, but it's covering a good amount of that. And as we all know, a lot of people have scars on their eyebrows, and they really they're sort of become a part of your personality, or something that people just embrace. So I think this is a really great thing to sort of hide this tattoo, or this damage from the tattoo. This is scarring that I'm assuming is from a tattoo previously, but I don't know. I question that because it's beyond the brow area. It looks beautiful now. Much better. Much less noticeable if that's what you're going for. Look at that. Looking good. Not done popping? Check out this next video or check out my all access membership page to watch more videos.